this week it's all about slowing the curve of the epidemic. So when we talk about that, we're really doing what we can now, whilst we still have only a relatively small number of cases of this infection in Australia, to decrease the pressure that we may find on our healthcare system in the coming weeks and months. We're seeing what's happening in Europe, in North America, and previously in China in relation to the healthcare issues that come from this virus. For most people, it is a minor disease, and we're finding that wherever it has developed in the world, that's pretty standard. About 80% of people that get sick with this virus have a mild illness. However, there are some, around 20%, that do require more serious health care, whether that's through primary care, general practice, or in hospital, and indeed in our intensive care units. And unfortunately, there are some people that die. Here in Australia, we now have almost 300 cases. That has risen quite significantly over the last week or two, and unfortunately now 5 deaths, all in elderly people. I'll make that point very clear as well. What we're seeing around the whole world is that for children and for young adults, the death rate is extremely low, and the serious illness in those age groups is also very rare. However, for people in the older age groups, and I would include myself in that, so people over the age of 60, they are more susceptible to this disease, and we are finding particularly in the much older age groups, 80 and above, that the death rate is actually quite high. So what we are doing today, this week, and throughout our response to this epidemic in Australia, is trying to slow that curve so that we can manage those serious illnesses when and if they occur. So we're now at almost 300 cases in Australia, 5 deaths. In the global situation, over 160,000 cases, and overnight we reached a milestone there as well. There are now more cases outside of China than there were in those early days when the epidemic was only in China. So just a couple of other things to say in terms of what we're doing. So yesterday there were announcements by the Prime Minister. I was with him in that press conference when he talked about mass gatherings and the limitations on those, and we're working through what that means in terms of particular sports, particular events and so forth, so that we'll have much clearer information for people in the days to come, so that individual organisers, event organisers, event venues and so forth can make their own decisions in relation to those matters. The other announcement was scaling up of our border measures, so that we're asking every person that comes back internationally from any country in the world to self-isolate for 2 weeks. Those were the 2 key areas that we talked about yesterday. This afternoon, myself, the Chief Medical Officer, Brendan Murphy, and the Chief Health Officers from all of the states and territories will be having a face-to-face meeting. This is the second time we've met face-to-face with the Australian Health Protection Principal Committee. We are now officially a subcommittee of the National Cabinet organisation, and so we will be providing specific information in relation to those public health measures and other matters to the next meeting of that National Cabinet, which is destined for tomorrow night. This is the second time we've met through the epidemic. We meet every day, of course, by telephone, but we find at these particular moments when things have changed a lot or new information has to be requires very detailed thinking and advice, we do meet together, 1.5 metres apart, of course. So I'm happy to now take questions on any of those matters.
Professor Kelly, just on the Prime Minister's asked you to review advice on enclosed spaces. Is that something you'll be reviewing today? And could you just clarify what that actually refers to?
So this is in relation to the mass events or the large gatherings. So whether there should be some specific information in relation to gatherings in enclosed spaces as compared with ones that are outside. So a football stadium versus a pub, for example. Should we be thinking about those elements? And just to revise what those elements are, we've set a number at 500. That's similar to other countries. Some have gone to smaller gatherings. I believe Austria announced 5 overnight. That would not be a mass gathering in my view, but it would be a gathering. It should be seen that Austria is at a very different time in the epidemic, many more cases. They're in winter and so on. So for us, we've picked 500. We feel that that's a reasonable amount. Whether that should be modified for internal events is something that will be under consideration
so
today.
So it could be a number less than 500 for internal events?
We'll be considering it today in AHPPC.
So
So our advice will be going to the from the Australian Health Protection Committee to the National Cabinet. We're in our subcommittee of that Cabinet. They will be making decisions. And just to stress, we are being asked to give frank and fearless medical advice from the beginning, and that's what we will continue to do. But of course, government should take that into account with other matters, social, economic and so on.
Professor Kelly, what do you do with something like aged care facilities? The elderly are particularly vulnerable. You've also got remote Indigenous communities where Indigenous Australians are also vulnerable. Do you look at isolating those particular areas and segregating them from the rest of the community, from the rest of Australia, to try and help prevent the spread of this virus?
Well, the two particular matters that you raised there are front of mind. So vulnerable people in general, including the disabled, but aged care, that's where a lot of the older people in Australia, the ones that are at most risk of the serious end of this disease, are residing. And so absolutely, we're taking that very closely and carefully and giving advice specifically around aged care in terms of residential aged care, but also home care. In terms of remote areas, a lot of particular issues there, many people with other chronic diseases, again, a high-risk community. But even more than that, of course, they're already remote and remote from healthcare. So they are of a particular concern, and indeed in the Northern Territory, this takes in mass events as well as remoteness. The Tiwi football grand final was on the weekend, and there were the community themselves made a decision to really limit the number of people coming to that. A major cultural event, a major sporting event for the Northern Territory has already been affected.
But what is that advice?
I think it's another question over here.
One of the issues that's emerging in Europe is the lack of ventilators. What's the situation in Australia? Do we have sufficient? Are we sourcing more? And could you rule out having to ration access to care in that sort of situation?
So I'll stress again that most people will not require a ventilator, so 80% of people will be mildly affected and won't even end up in hospital, let alone intensive care, let alone needing ventilation. That's very much the end of the spectrum. I'll reiterate again also that what we're doing in terms of public health things at the moment, in terms of the mass gatherings, in terms of the isolation and so forth, is all about flattening that curve to decrease the pressure on intensive care. So we're doing all of that. To answer your question, that's also come up in the US overnight, and so yes, we're looking in a very detailed way across all of Australia's intensive care units, working closely with the Australian and New Zealand Intensive Care Society and states and territories to look at exactly that issue.
Do we need more in the country? Is that an issue?
Well, we're looking at the supply and we're looking what we can do to dampen the demand, so I'll leave it at that.
Professor Kelly, when it comes to aged care, you're obviously looking into that. What are some specific measures that you will be discussing, some specific options? Is there anything you've seen overseas that you'll be looking at?
Well, certainly we need to do what we can to limit the opportunity for the infection to come into aged care. So there are, yes, a range of measures that we actually put in place in flu seasons when there's either a large number of influenza cases in the community or indeed if there is an outbreak within an aged care facility, to look at what we can do within the facility to make sure anyone who's sick is separated from others, but in the first case to try and limit the opportunity for the infection to come in. There's certainly things that are on the table and we'll be providing more advice on that in coming days.
Professor Kelly, with the 2 deaths we've seen overnight, in both cases the 2 women who passed away were tested and proven positive for coronavirus after they'd actually died. So it wasn't known at the time that they had it. Is that a concern to you in terms of how we are conducting testing, specifically given that one of those cases was in the aged care home that had that mass outbreak?
So certainly we are prioritising testing to where we think that most of the cases are at the moment, and for now it's still the case that most of the people that have COVID in Australia right now are actually people that have come back from overseas. We're on that tipping point to an extent where there are now some cases we're finding that don't have that definite link. But for the time being, the testing is certainly being prioritised there, plus areas that we know where there is an outbreak, and that one particular aged care facility in Sydney is one of those places. So yes, we need to be looking closely at people that have these type of symptoms, and to test them where that's appropriate.
Is Australia running out of testing kits for the virus, and are we looking to secure more supplies?
So the testing kits are fine. There are some areas, there are some issues in relation to some of the consumables around the test, and we're certainly looking very closely at that. That's a global issue. As you can imagine, there's a lot of testing going on. All of those 160,000 people that we have definite diagnoses on have all had at least one test. And this is a rapidly emerging issue. A new test wasn't there a couple of months ago, so these are not surprising, but we're looking at ways that we can deal with that shortage.
What are some specifics around that, please? What do you mean by consumables, and how long do our supplies of testing kits last? And is this what's driving your decision not to test more widely than the people returning from overseas and people in contact?
So we need to be careful and prudent about our testing. But just on testing, you need to look at where you get your best bang for the buck, really, because so for example, in one state they opened a couple of fever clinics. Immediately 1,600 people were tested. Only one of those was positive. So I think that we have to look at very carefully at how we're doing the testing, where we're doing the testing, and yes, that has put some strain on some of these consumables in the laboratory. I won't go into the details, but there are many things in the laboratory that are needed other than the tests.
Can you tell us how long it's going to last, or how much longer the testing will last?
Yeah,
they're available at the moment?
we're continuing to test.
Just on masks.
What's your level of concern for taxi drivers, Uber drivers, those people who are picking up international visitors or people who return from overseas before they can self-isolate?
Yes, that's an issue, and in fact we've had some people ask about that, the travellers themselves as well as the taxi drivers, Uber drivers and so forth. In other places they have been a risk group. What I'd say at the moment is those issues about we've asked people to self-isolate when they come in through the border from midnight last night. This is about slowing the epidemic. It's not about stopping it completely. We will have more cases. What we're trying to do is have less and over a longer time. So in terms of the masks themselves, we won't be giving out masks to people unless they are actually symptomatic at the border.
Grandparents looking after their grandchildren, should those sorts of arrangements stop?
Well, I think people have to make their own decisions. Look, we're all in this together, and people will have to decide themselves about their own risk and the risk for themselves and their children. And it's certainly something that people should be considering. That vulnerable group are the elderly.
Just on masks, are there enough for GPs to be able to treat patients? We sent off a bunch of masks to China while the epidemic was going on there. Was that a wise decision? Do we now face a shortage of masks?
So we have masks. We have our national stockpile. We have over 20 million masks in our national stockpile. States and territories also have their stockpiles. Look, it's no secret that masks are short around the world, and we're looking at every way we can to increase supply into Australia, including boosting local production, and that's a real focus for us at the moment. We're also looking at decreasing demand. What can we do in terms of limiting the masks that we have to health workers? The last thing we want is for health workers to stop working because they're concerned.
What percentage of the population are you modelling to be infected in the next month and a half? Is it 20%? That's what New South Wales was talking about on Friday. Or I've heard doctors say 60%. What's your modelling saying?
So yes, I think Angela Merkel said 60% of Germans the other night. My colleague Kerry Chant talked about 20%. It's something in that range. I'm not going to speculate on the actual numbers, but this is an infectious disease. The more we can do to separate people and to stop that infection spreading, the better.
What would be a result of that?
Well, the death rate's around 1%, so you can do the maths.
Professor Kelly, we've heard a lot in recent weeks about the AHPPC. It is now one of the most powerful groups in the country giving advice to governments around the country on this crisis. People wouldn't have heard of it until now. What is it and what does the AHPPC do?
So the Australian Health Protection Committee, yes, hasn't been a celebrity committee up till now, it must be said. So I think everyone's heard about it in the last few weeks. What it actually does, it brings together the best medical expertise from the public health point of view, from the states and territories, from the federal government, and some invited experts. So the modelling and so forth you've been seeing presented by the Prime Minister yesterday, we have a modeller that's been co-opted onto the committee. We have infectious disease experts. We have others that are more expert in laboratories and so forth. So that's a group that we meet. It's been meeting for many, many years on a regular basis, and since the start of this epidemic, and indeed before that in the bushfires, was meeting on a daily basis. We've been meeting virtually daily since January. And so we're there to provide that public health advice, to gather the evidence from infectious diseases, from laboratories, from emergency specialists and others, to provide that advice to government so that they can make the decisions that it's to make.
A lot of businesses giving advice to work from home. Is that something the health department recommends?
Sorry, can you just repeat that?
A lot of businesses are telling their employees to work from home. Is that something the health department recommends?
So we're all in this together. So we need to start thinking about what we can do in that personal isolation piece. Not to become isolated, we still need to be there for each other, but to think about, and this is something for all businesses, to think about what we can do to decrease infection in our own workplaces. It's particularly important for those that are involved with emergency services, with healthcare, and so forth, to consider what feasibly can be done in that way. This last question. Yes.
This morning there's been reports that there were 2 people infected on a flight with Peter Dutton. What's your best assessment of what is happening there? Is that a coincidence in your view, or does that indicate that it's possible that he was infectious earlier than we thought? What's the likelihood, and what do we do? What are you doing?
So I spoke to Mr Dutton in his hospital room on Friday night, and I'm not going to go into the details of his particular illness, but I can say that he was not infectious on the plane. Whether he caught it on the plane or before that, it's hard to know. We know that the incubation period for this particular virus is quite long. It can be up to 14 days, but mostly 5 to 6 days. He'd been back in Australia for, I think, 6 days by the time he became sick.
So he was not infectious on that plane?
I don't believe so, no.
Just on the international self-isolation, we've talked about taxi drivers and things. What about people who then get domestic connecting flights to continue home? What's the advice around them? Should they be somehow distancing? What's the risk there?
So we've been dealing with that issue since the start of this epidemic, and so essentially, if people are found to be symptomatic when they arrive, then they won't be travelling on. But people that are well when they arrive will be allowed to travel back to their homes, and that's the best place for them to be. Thanks. I'm going to leave it there. Thank you.
Deputy Chief Medical Officer Paul Kelly there with an update on the official response to the coronavirus.